you, TJ?
Yes.
Hi, I'm Ellen. I'm your occupational therapist. How are you doing today?
Good. How are you?
Good. Thanks for asking. So I was just looking at your chart from your doctors, and it looks like the surgery all went fine yesterday on your tendon. How are you feeling?
A lot better. The surgery helped a lot.
Good. What symptoms were you feeling prior to surgery?
A lot of pain and stiffness.
Stiffness. That makes sense. Those are both common symptoms with the injury that you have. Did you also have difficulties extending your fingers?
Yeah, I did.
Yeah, that's also common. So did the doctor really even explain to you like what your injury was?
No, he didn't.
Okay, so your injury is what we call, if you want to look at this sheet, we call it a laceration of the extensor digitorum in zone 5. And so basically what that is, if we look at your hand really does two main functions. It kind of flexes the fingers and the wrist, and then it also will extend the wrist and its fingers. If we look at this side of our hand, we have a group of muscles that we call the flexors, and these are the muscles that help to flex your wrist and your fingers. However, if we look at the back of our hand, we have another group of muscles, which are the extensors, and these are the muscles that help to extend your fingers and your wrists. So in looking at your injury in particular, if we look at this picture, you damaged a tendon in your extensor digitorum. This muscle starts way up by your elbow, and then it goes down your arm through your wrist, and when it gets to the palm of your hand, it actually separates into 4 different tendons, which each connect at the tip of the finger. And so you damage your tendon, or the tendon that helps extend your pointer finger, and so that's why you are having difficulty with that. And then as for the zones, the back of your hand is separated into 8 different zones if we look at this picture, and these zones just help professionals like me and the surgeon evaluate and know how to treat your specific condition. So when we're looking at zone 5, this is the area right over these knuckles right here. This joint is called your metacarpal phalangeal joint, and it's just the area that connects your fingers to the base of your hand. And then, like I said, you had a laceration, and a laceration is just an injury caused by tearing of the skin, which is probably why you saw like the pain and stiffness. And then did the doctor or the surgeon explain to you what they did in surgery?
No, they didn't.
No. Okay. It was a pretty simple surgery, nothing too complex. Basically what they did is they went into the laceration and where the injury took place, and internally found the 2 ends of the tendon, and then put a couple stitches just to connect the tendon back together. After they did all that work internally, then they just stitched up the outside of your hand where the cut took place. And then after that, I'm sure you could tell they wrapped it up with some gauze and a Band-Aid, and then put you in the splint that you're in now. And then they referred you to come see me in OT. And so I'll walk you through a little bit of the treatment that you can expect to do with me. So occupational therapists with an injury like yours will focus a lot on wound care and edema control. And so wound care includes things like cleaning out the injury site, replacing the bandages and the gauze, and then I'll also teach you how to do that so you can do that at home. Doing this just helps protect the wound from becoming infected. And as for edema control, I'm sure you've noticed some swelling post-surgery, which it's a common symptom after you have any type of surgery. And so what we'll work on is at different stages, we'll ice and elevate the hand, and that'll help the swelling go down. And as for time length for that, it just kind of depends how much swelling you're experiencing. We can expect to ice anywhere from like maybe 10 minutes a day to up to an hour, depending on what swelling you're seeing. And then OT will also work with you on modifying some of your activities. I'm sure now that you're down a hand, you'll have difficulties doing some of the things you do every day. Are there anything you can think of off the top of your head that you use that hand for a lot?
Yeah, at work I do a lot of typing and then also some writing.
Writing, okay. Yeah, both of those are going to be harder now that you are down a hand, but we'll be able to work with you, and I have a lot of different assistive technology devices that can help with those tasks every day. during further treatment sessions, we'll get into some of those different technologies, but they could be something like using a different keyboard that only requires one hand or something like that, but we can explore those options when we get to that point. As for therapy, it will be quite rigorous at the beginning of the treatment. I'll want to see you 2 to 3 times a week for the first 4 to 5 weeks. And then after we get through those initial 4 to 5 weeks, we can drop down to once a week. And then another protocol that I'm gonna use with you is what we call the short arc of motion protocol. This protocol just really emphasizes the fact that we need to keep that joint moving right away, even post-surgery. If we don't move it enough, the joint can actually grow to the bone, and it will cause you to need another surgery down the road. And not moving the joint also can cause a lot of stiffness, which can cause you to have a decreased range of motion, even when you're fully healed. So in order to do this short arc of motion protocol, we're going to use what we call a dynamic splint. A dynamic splint is a splint that actually allows some movement of your joints even while you're wearing the splint. And we can modify how much movement we allow you at different points in the treatment. So at the beginning, 3 to 5 days after your surgery, we'll put you in this dynamic splint, and we'll just start out with very minimal movement of maybe just like a couple millimeters at a time. And as your body can work up to moving more, we'll slowly increase the amount that the splint allows you to move. And then so while you're in the splint, it's going to be important that you do exercises every day. I can show you some of those exercises later once we get into the splint, but they'll be simple exercises such as like extending your fingers and then flexing them back down. And it'll be important that you do those at least 10 minutes every day. And then once you get your normal range of motion back restored, we'll be able to remove the splint and start some strengthening exercises, and this will help get your hand back to the function that it was at prior to the injury. Do you have any questions with that?
I don't think so.
No? As for expected outcomes, I'm sure you're wondering when you can expect your hand to be back to normal functioning. It's really hard to give you an exact date, as everybody is different and everybody's body heals differently. But on average, I can tell you that most people are about 50% healed after 6 weeks, and usually after 12 weeks, we see people at the 100% and able to do the occupations that they were doing before. And then quickly before we end this, I'd just like to go over some of the safety precautions with you. So it's really important that you attend these recommended therapy sessions, just as I was saying. If we don't do them, we can have other difficulties down the road. It's also important to perform your hand exercises and not to do less or more than what I'm recommending. We don't want to do too little, or we can cause stiffness or like I said, the tendon to grow to the bone. But if we work our hand too much, we can also risk having a rupture in the stitches, and that will cause you to have to go back through the surgery to get the tendon repaired again, and you'll have to go through this whole treatment process again. It's also important that you follow the weight-bearing recommendations, and those will change throughout the duration of the treatment. As for now that you're just a couple days post-op, it'll be important that we don't do any weight on that, and that includes pushing or pulling as well. You can do anything with your opposite hand, but with your injured hand, it'll be important just to keep that with as little movement as possible. It's also going to be important that you keep up with your wound management, as both me and the other doctors you see recommend. I'm going to want you to change your bandages quite often and stuff, just to reduce the risk of infection. Infection can slow your treatment process down. And then lastly, since you are just a couple of days post-op and you'll be on some pain meds to help you manage the pain, it'll be really important that you wait a couple of days, probably 7 to 10 days before returning to work.
Okay.
Do you have any other questions?
I don't think so.
Okay, thank you so much for meeting me.
Yeah,
It was
thank
nice
you.
to meet you.